Good afternoon, everybody. Today, there is something special I want to share with you. So now, let's begin with this case study. A 52-year-old male presented with severe pain in his wrist and big toe, right big toe, which was accompanied by inflammation and erythema of the joints. Patient's medical history is significant for hypertension and diabetes. Physical examination and routine laboratory investigation revealed overweight, where a patient had a body mass index of 27 kilograms per meter square. And the serum uric acid was 11.2 grams per deciliter, respectively. The patient stated that he drinks 6 packs of beer daily, 6 packs of beer daily. So now you can look at this case. We have a patient who came with severe pain. The pain is localized at the wrist and the big toe. And this patient is known hypertensive and diabetic. And the physical examination revealed the patient was obese. He was overweight. The body mass index was 27 kilograms per meter square. And when you look at the uric acid levels, we see that the uric acid levels were high, above the normal range. As we know, the normal range for uric acid levels is below 7. For female, is different from male. So any level of uric acid above 7 grams per deciliter is considered to be hyperuricemia. When you have hyperuricemia, it means you have the higher levels of uric acid in your blood, in your serum, in your blood, above the normal range. And the patient stated that he drinks 6 packs of beer daily. So now we can discuss this case. What is the possible diagnosis for this patient? What would be the possible diagnosis for this patient? From these findings, from your physical examination and from the laboratory investigation, what would be the possible diagnosis for this patient? So today I want to share with you something about gout, care of patient with gout. What is gout? And what are the risk factors for gout? What causes gout? And what is the pathophysiology of gout? What are the signs and symptoms of gout? What are the diagnostic measures of gout? And finally, we shall look at the nursing care, nursing management of a patient with gout. These are our learning classics we are going to cover in this session. Now, gout, as we have seen in our case study, our patient had a higher levels of uric acid, and therefore gout is considered to be a metabolic disorder in which purine metabolism is altered and the byproduct uric acid accumulates. This accumulation of uric acid is hyperuricemia. Hyperuricemia is when the levels of uric acid are above the normal range. So gout is a metabolic disorder where the purine metabolism is altered. Purine are organic substances which we obtain them from the diet, and other are made within our bodies. Purines are made within our bodies, and they are made within our bodies, and some purines we obtain from the diet. Purine are organic compounds which are made in the body, and other purines we obtain from the diet. Purines are necessary for the body to function. Purines are necessary for the cells of the body to function. But whenever they are produced in large amounts in the body, they become problematic. They cause this condition known as gout. Even when you look at the structure of DNA or RNA, you shall see the purines. The purines in DNA are guanine and adenosine. They are purines. Those nitrogenous bases in DNA are purines. So when these purines accumulates in the body, they cause hyperuricemia. Gout can be classified as primary or secondary. It can be primary or secondary. So later we shall see the difference between primary gout and secondary gout. Primary hyperuricemia, primary gout is a gout due to primary hyperuricemia, and secondary gout is that gout due to secondary hyperuricemia. Gout results in deposition when the levels of uric acid or urate becomes high. The compound which is formed is monosodium urate. Monosodium urate, which crystallization of this compound results into deposition of this compound in the joints and soft tissues, with accompanying inflammation and degenerative consequences. That's why our patient suffered severe pain due to inflammation. In a case study we have seen, our patient suffered severe pain due to inflammation. They suffered severe pain of the wrist and the toe. You can see here in this picture, this is the right foot. It is the right foot, and here around the big toe, you see the redness. This redness is known as is called erythema. Erythema is this redness and the swelling. You can see. Now, what are the causes and risk factors of gout? Gout can be classified as primary gout due to primary hyperuricemia. Primary hyperuricemia may be hereditary, or maybe due to severe dieting or starvation, or excessive injection of foods which are rich in purines. For example, meat, shellfish, liver, sardines. These are food which are rich in purines. So if you ingest excessively these foods, you are likely to have higher levels of uric acid in your blood, in your body. Severe dieting or starvation. Severe dieting or starvation increase serum uric acid levels by inhibiting renal excretion of uric acid due to ketosis. But in most cases of primary hyperuricemia, in some cases of primary hyperuricemia is due to hereditary causes. It may be due to heredity. When there is a defect in when there is hereditary defect in purine metabolism. If you have a defect in purine metabolism due to hereditary defect, that is considered also to be a primary hyperuricemia. So concerning secondary hyperuricemia, secondary hyperuricemia can be due to acquired or genetic processes, such as hematopoietic disorder. In hematopoietic disorder, such as multiple myeloma, leukemia, or polycythemia vera, those conditions may result into increase in cell turnover and increased uric acid production. So the hematopoietic disorder, those diseases or disorders which affect the blood and blood forming organs, So those diseases such as leukemia, the malignance of the blood forming organs, the multiple myeloma, the malignance of plasma cells, the malignance of plasma cells. If there is any disorder which affects the blood forming cells, that disorder is called hematopoietic disorder. And in these disorders, there is increase in cell turnover. Cell turnover means the number of cells which die is greater than the number of cells which are regenerated, which divide. The cell, there is imbalance in increase. When there is increase in cell turnover, it means that the production of cell is lower. There is low production of cells. The number of cells which die is greater than the number of cells which are being produced. That is increase in cell turnover. So if there is increase in cell turnover, also there is increase in uric acid production. Another reason for secondary hyperuricemia is chemotherapy and radiation therapy. In chemotherapy and radiation therapy, there is massive destruction of cells, which results into increased uric acid production. In renal disorders, there is reduced or decreased excretion of uric acid. Therefore, the uric acid accumulates in the body, resulting into hyperuricemia. In renal disorders, you have decreased excretion of uric acid. In alcohol intoxication or alcohol consumption, excessive consumption of alcohol increase serum uric acid levels by inhibiting renal excretion due to lactic acidosis. Some drugs which decrease uric acid excretion, and those drugs which increase production of uric acids may result into hyperuricemia. What is the pathophysiology of gout? Urate is a sort of uric acid. It crystallizes in body tissues and is deposited in soft and bone tissues, causing local inflammation and irritation. Collection of urate crystals is called tophi. Tophi are found in the cartilage of the outer ear, pinna, the great toe, hands, and other joints, ligaments, bursa, and tendons. As these deposits accumulate, they destroy the joint, producing a chronically swollen, deformed appearance. The uric acids precipitate in urine, causing renal stones. Causing renal stones. The signs and symptoms of gout include acute pain and tenderness in one joint in cases of acute attack. The skin turns red, erythema, and the joint swells so that it is warm and hypersensitive to touch. Fever may be present due to inflammatory response. Tophi may be palpated around the fingers, great toes, or earlobes, particularly if the client has chronic and severe hyperuricemia. The attack may last for 1 or 2 weeks, but moderate swelling and tenderness may persist. The diagnostic measures of gout usually are based on synovial fluid aspirated from the joint during arthrocentesis and contain urate crystals. The arthrocentesis is a procedure in which the synovial fluid is drained from the joint. That draining synovial fluid from the joints is called arthrocentesis. Urate deposits also may be identifiable with a radiographic examination, such as X-ray. Elevated uric acid levels in serum and the urine. When you collect urine, that 24 hours urine correction correct with gout, but these findings are common to other disorders as well. So you need to exclude other conditions which may cause elevated uric acid levels when you use urine to find out if there is gout. Serum uric acid levels and white blood cell count are elevated during the acute gout attack. In acute gout attack, the white blood cells are elevated, possibly due to inflammatory response. Uric acid levels are chronically elevated in about 20% of patients. X-ray of the articular cartilage and subchondral bone shows evidence of chronic gout. Needle aspiration of synovial fluid shows needle-like intracellular crystals. So what is the nursing management of the patient with gout? In nursing care, we provide supportive care for this patient. We manage pain, and we give medications in order to treat the condition. Medications may be prescribed either to relieve pain or to inhibit the production of uric acid, or to increase excretion of uric acid. So medication may be prescribed for such purpose, to relieve pain. In case we administer analgesics, we administer analgesics in acute attack of gout in order to relieve pain. Now, you have to place a bed cradle over the affected joint to protect it from the pressure of the bed lining. Institute bed rest during the initial phase of an acute attack, focusing on resting the affected joint. Instruct the client to report gastrointestinal symptoms. Gastrointestinal symptoms may be caused by some drugs, such as colchicine. Colchicine may cause gastrointestinal symptoms, GIT disturbances such as diarrhea, possibly due to adverse effect of a drug to the GI system. So management of acute attack include the use of analgesics such as colchicine and non-steroidal anti-inflammatory drugs to reduce pain and inflammation. Non-steroidal anti-inflammatory drugs like naproxen, indomethacin, those drugs can be used to reduce pain and inflammation. You have to monitor intake and output, especially when diarrhea accompanies colchicine therapy for acute gout. Medication which block formation of uric acid, such as allopurinol, may be administered if patient has elevated levels of uric acid. If your patient has hyperuricemia, we can administer this medication which inhibit formation of uric acid. We can also administer medication which promote excretion of uric acid. Also, there are medications which can promote excretion of uric acid. We have those medication which can promote excretion of uric acid, such as probenecid, which promote excretion of uric acid. Probenecid. Probenecid is a medication which can be administered to this patient because it promotes excretion of uric acid, but also it promotes resorption of uric acid deposits. The regimen is individualized, may be changed in response to the changes in the cause of disease. Management depends how your patient responds to the management. You have to encourage on less lifestyle modification. If your patient eats too much food which are rich in purines, you can encourage that patient, your patient, to reduce eating those foods which are rich in purines. Also, if your patient is taking alcohol, you can encourage him to reduce drinking alcohol, if not to quit from alcohol. So now, also you have to provide a clear explanation of long-term drug and diet therapy before discharge. Now, key points. In summary, gout is a painful metabolic disorder involving an inflammatory reaction in the joints, usually affecting the feet, especially the great toe, hands, elbow, ankles, and knees. Gout is due to hyperuricemia. Gout is a metabolic disorder in which purines metabolism is altered and the byproduct uric acid accumulates in the body. Common signs and symptoms of gout are acute pain and tenderness in the joint, in one joint. The skin turns red, erythema, and the joint swells so that it is warm and hypersensitive to touch. And fever may be present, possibly due to inflammatory response. Thank you for listening.